The Gauteng Department of Health has obtained an interdict from the court barring Operation Dudula members from protesting outside the Kalafong Hospital. The movement is accused of preventing patients from entering the facility, accusing some of them of being in the country illegally. Now, some of those people were allegedly stopped from entering the hospital based on their accent and appearance. Let's talk about this with Sibongile Tshabalala from the Treatment Action Campaign. A very good afternoon to you, ma'am. Thank you for your time. What do you make of what's been going on outside Kalafong in recent days?
Thank you for having me. As Treatment Action Campaign, we are disappointed at what is happening at Kalafong Hospital, because what the Operation Dudula is doing, we are not supporting it, and we are anti-attack of our African brothers, because what they are doing and where they are showing their anger, or they are directing their anger at the wrong people. Everyone who's in South Africa didn't just come in South Africa. They came because they have challenges in their countries. And what is important for us as South Africans to remember, we are all Africans, and borders were never created by us as Africans, but the apartheid regime and the colonialists came and created these borders amongst us. When we are talking about Africa, South Africa is part of Africa. So you cannot chase away people from their own continent, while Europeans are staying in Europe and not chasing each other. So we cannot be divided by the borders that are not created by us. So as Treatment Action Campaign, we are not supporting what Operation Dudula is doing. We are not supporting the medical xenophobia that is happening in the country. We are not supporting any form of human rights violation.
So those in favor of what's been going on at Kalafong Hospital and that video that we all saw of the Limpopo Health MEC, Dr. Poppy Ramathuba, this time a week ago, say that the people who are outside Kalafong are justified in their action because the presence of people who are in the country illegally, illegal foreign nationals from the continent, is basically so much that it's collapsing the healthcare system, and that locals are then disadvantaged as a result. As an organization that works in the health space, is that true from your observation?
No, that is not true. People, they should start to face facts and truth. You know what is happening, and what Operation Dudula is doing is they are trying to remove the focus from where the problem is. Our healthcare system has been in crisis for years, and the collapsing of the healthcare system lies on our government's failures to address issues of corruption that are happening in the country. Millions and millions of rands have been stolen from the public purse, and people like Operation Dudula or operations like Operation Dudula are quiet about those issues. Though that's where the problem is, because the money that is allocated to provide services on the ground, it's not going there, but it's going to the corrupt politicians who are leading this country. And when they need to direct their anger to the people who are stealing from a public place, they are directing their anger to poor people who are suffering, who have been violated in their countries, and run to South Africa to find safe space, and forget that these people are not just coming in South Africa. These borders that I spoke about earlier on, that I said they were created by colonialists, the people who are working on those borders are our officials, South Africans. Aaron Motsoaledi should fix his department, and the Minister of Health must fix his department. And the anger and the collapsing of healthcare system, we should direct it to them, to the minister, to the government, not to poor people who are on the ground, who are here to seek help. These people that we are calling illegal, where did you find a person who's illegal? Why do you call a person from Africa who to say is illegal? How about white people who came to South Africa? What are they saying about them? I don't want to be racist, but then we need to be careful of how we are saying. How many white people, Indians and other people who have come to South Africa to seek good businesses and doing businesses with South Africa. Why are they not talking about those people?
Well, the assumption on that level would be that those are people who are in the main seeking private health care or able to pay.
No. People who are South Africans, we know that in South Africa we have Section 27 of the Constitution that says we all have to access quality healthcare services. It doesn't specify to say you need to come from where. And remember, there are international laws that South Africa and other countries have signed. So South Africa has signed international laws, so that is why we have a right, or we are able to cater for people who are running away from their countries to South Africa. So these people who are here, regardless that they are making business or what, if they can be able to make business, what stops South Africans to make business? These people are not stealing from anyone. When they are seeking help, it's because they are human beings, they are sick, they need to be provided with help. So they can't be violated just because they are human beings and be treated like less human beings because they are not coming from South Africa. South Africans need to remember where we are coming from. I was watching the video from one of the people who said he was a freedom fighter. He fought for this country. If that person has fought for freedom, he should know the history of South Africa. Who supported South Africa when we were under apartheid? The countries like Tanzania, like Zimbabwe, and other countries, Swaziland, we know that our leaders were running to those countries to be in exile, and that's where they were catered for. That's where they were trained. That's where they managed to revive the struggle of our black people to be in freedom. But now we are saying we don't want Africans. That helped us when we were in challenges. That means we are not grateful as South Africans. So as TAC, we don't support any kind of xenophobia, and we denounce any kind of xenophobia. Rather, it comes from the government, or it's coming from Operation Dudula, or any community members, because we are in Africa, we are Africans, and will remain in Africa.
We had the incident, like I was saying, in Limpopo last week with the MEC, Poppy Ramathuba. There's been what's going on at Kalafong now. I think it was, in fact, Doctors Without Borders that said that xenophobia was intensifying at South Africa's healthcare facilities. Of course, those who disagree will say what it is merely a call from South Africans for locals to be put first and the healthcare system. But where do you see this going if we continue to see a recurrence of these incidents?
You know what happened last week, and the MEC of Health of Limpopo. We are discouraging it as TAC, and we are not supporting that. And we are calling for the MEC of Limpopo to publicly apologize for what she did, because that is human rights violation. And we are calling for the Department of Health to do something about her position, because she's in a leadership position. And it's wrong for our government to keep quiet while people kept on being rights violated. So as TAC, we are not, I'm still saying this, we are not supporting any form of xenophobia. We are denouncing what OP has done. We cannot justify xenophobia in terms of the crisis that we have. The crisis that we have in South Africa, our government failed us. ANC government failed us for 24 years, for 27 years. And we can't shy away from that. And they are trying now to focus, to direct our focus to other problems. You know, these politicians like Poppy and Aaron Motsoaledi are very cruel, because they know that they failed the people. We were promised a better life. We were never promised to discriminate against each other. We were never promised to say we're supposed to fight for the resources. They are fighting amongst themselves in the ANC, fighting to steal our resources, and we are not focusing on those issues. We need to focus on them, to say, why are you stealing our resources? When are we going to hold accountable those who have stole from the public purse? Just when we were in COVID, when people were dying, the former Minister of Health, Zweli Mkhize, stole about 150 million. What are we saying about that? That 150 million could have done so much in the country. That 150 million could have supported so many people in the healthcare system. So why do we want to blame poor people who are trying to make means to live? And why do we deprive other people their right to live, to life? Why we want to exercise our own rights? We need to direct our anger where it's needed, not on poor people.
Sibongile Tshabalala from the Treatment Action Campaign, thank you so much for being with us today.